can take this one. So when I was kind of looking for residencies, and my experience is probably a bit different from everyone else's, and just that I didn't look broadly for my residency program. But one of the biggest things, like I mentioned just in my definition of wellness, is really looking at programs that you could really get a sense of the culture, and really like a culture of support and of building relationships and of people being invested in each other. You know, faculty invested in the residents and residents invested in each other and in the faculty. And so for me, it was really important to try and get a sense of that. And I am very biased in our program, but I was able to rotate at our program when I was a medical student. And so I was really able to kind of immerse myself in the culture there. And I could really see that everyone was really invested in each other, and really like knew about each other's lives outside of the residency program. And so I think it lends itself to wellness when you're able to get to know people beyond, you know, just their role as a resident or as a faculty member, because then you're invested in their wellness and you're invested in kind of building that relationships and that kind of safety and trust for people to share about, you know, hey, I'm having these feelings of burnout, or, you know, I need some help. So that was really important for me when I was looking for a residency.
Great. Joanna, do you want to weigh in on that one at all, or do you want me to move on to whatever?
Yeah, that was pretty similar to what I was looking for as well, was really a kind of warm, welcoming culture where everybody was really approachable. And especially, I think an approachable faculty can help with that as well, just making sure that you're feeling welcome. And then also a faculty that's receptive to resident ideas and feedback, and that everyone, like Christina was saying, everyone's kind of invested in each other and invested in a culture of learning and improving the program.
That's great. So I'm going to actually try this polling function, everybody. Just try to keep this engaging. And then as I do that, we'll go ahead and ask you the next question. So here comes the poll that you can just have on in the background. So the next question that I have for you is, what were you worried about prior to starting residency? Is like in your fourth year, in that March through mid-June time period, and what did you do to try to reduce that anxiety? And this was really more of a question for Christina and Joanna. Kathy, you get a pass on this one since it's been a while.
In a long time.
It's funny, we just did a didactic session on imposter syndrome, and Christina and I had both been thinking about that earlier today, in that we were both kind of worried about feeling if we were good enough when we started residency, and worried if we'd fit in. So those are some of the big worries that came up. Fortunately, at our program, everyone was so approachable and wonderful and welcoming that it wasn't hard to fit in. But I think the imposter syndrome is something that we all, a lot of us struggle with throughout our, from college through medical school and probably through residency and probably onward as well.
Yeah, I'll just piggyback off of that totally, and kind of reflecting back on that transition point, just definitely the feeling of imposter syndrome, and are you going to feel like you're on the same level as everyone else? And I think one of the things I shared in that discussion earlier today at our didactics was like also starting to think about this next transition point, kind of going from residency to working as like an attending, is, you know, having similar feelings come up about that. So I think, you know, just in this process, inherent in it is that we're kind of a bit perfectionist and just looking to others and kind of seeing, like, comparing ourselves to others. And I think we all walk through life in different ways and have different experiences. So it's hard to compare ourselves, but I think we have to always keep in mind that, you know, we made it here for a reason. And so to just kind of always look to the why and look to where you've been to be able to move on to the next thing.
That's great. I see a good question that correlates with the one that I just asked coming in on the chat. But before I do that, let's talk a little bit about this imposter syndrome. And like most of us have experienced that at some point. What did you do during that transition into residency and in those first weeks and months of residency to help try to get past that and either suppress it or acknowledge it, or, you know, what's the strategy to try to get over that feeling of not belonging.
I think thankfully our class, is really cohesive, and I think we could articulate our worries with each other a lot, especially sometimes at Ballant, where we have a psychologist kind of mediating our sessions as well. And then it was reassuring to find that a lot of us had the same fears and anxieties, and I think that helped combat the imposter syndrome. And then just being kind of pretty supportive of each other. And then we also have our faculty's very approachable, and so feeling like there was no wrong question or any bad questions, and that you could really ask anything that came up was important, in feeling like your questions were valid, and that asking questions was an important part of taking care of your patients as well, to make sure they got the best care possible.
Great. Christina, did you want to field that one too?
Yeah, I completely agree with you, Joanna. Is just like, inherent in our residency is that culture of support, and our class, I love our class, but I think early on we were able to identify like we all had very similar fears. And so being able to have just that support within ourselves was really awesome. And I think also just in reflecting back through like, the journey through medical school, it's like every new rotation, every new attending, every new, interaction is, a new experience. And so you might have similar feelings of like, oh, am I good enough for this rotation? Or, there's going to be something that you're not going to know or you're going to fail at. So just kind of reflecting back to that, like you were able to get through that. So you're going to be able to get through this next thing is something that I always look back to too.
Great. And I'm supposed to be kind of the host and moderator on here, but I've been in this business a while and have seen a lot of residents, and Christina and Joanna are two rock stars. And I think it's just important to normalize this feeling of imposter syndrome, because if two people like those two felt that way, almost everybody's going to. And I think just being able to talk about it amongst your classmates and acknowledge it and try to figure out how to work through that is an important thing to do. So this other question is coming in here that's completely correlates with what we've been talking about. So Marissa, I'm going to ask you to turn your microphone on and go ahead and introduce yourself and ask this question. I see Marissa talking, but microphone is not on. Let me see if I can help her.
I got it figured out.
Okay.
Cool. Hi, so my name is Marisa Strobridge. I'm a third year, almost fourth year medical student at Midwestern University out in Glendale, Arizona. And I was wondering, since you've all kind of mentioned that wellness is a personal journey, obviously, what would you say was most important for you in maintaining wellness in the transition from medical school to residency?
Great question. Christina and Joanna, we're going to have you field that one if you don't mind.
Yeah. So I think I've kind of shared this already, that my wellness is really kind of based upon my relationships with my family and my loved ones. And so in kind of preparing, I honestly didn't have a lot of like space between finishing medical school and jumping into residency. I kind of used that time to really kind of regroup with my family, and think about ways that we'd be able to still stay connected during the next couple of years of residency. And fortunate for me, my family's not super far away. Not that I'm able to see them all that often, but kind of reminding us that, we're going to need to check in on each other, or me even asking them, like, just be sure to check in on me, even if it's just a text or a phone call, or leave me a voicemail. And so I think that was really important. And the other thing is, I've been with my partner for almost 12 years now, and this whole process of going through medical school and in residency, we've not had a lot of quality time together. So kind of just also, game planning, how are we going to be able to survive this next hurdle, this next journey? So I think just like really being open in your discussions of, what is wellness for you and kind of what you want to prioritize is really helpful.
Thank you.
Thanks, Christina.
Yeah.
Joanna, did you want to answer that one too?
Yeah, I think just one concern I always had coming into residency was and that's really important for me, is sleep. And just making sure you get enough sleep is really important to my personal wellness, but it's actually been all right in terms of the sleep schedule and making sure that you're getting adequate sleep. And then my husband, sorry, my dog just started squeaking.
He's part of wellness. That's quite awesome.
Yes, he's a huge part of wellness. We got him as a puppy when I started, which probably wasn't the best decision. But he's been a huge part of looking forward to coming home and finding joy at home, and then keeping us out in nature. Even if it's only one day off a week, just getting some sunshine and a hike in can be really helpful to getting you ready for the next day. And then my husband and family have just been wonderful in terms of making sure, I guess eating and sleeping are two keys to my wellness, and they make sure I stay fed and that I get enough sleep, and that really helps with everything.
Great. So I will move us on to one of the other questions that had come in earlier, not necessarily off of this chat, but one of the factors that can support wellness and prevent burnout is a sense of control and empowerment. So how can residency programs provide that for residents? And I'll open that up to any of the three of you who want to take a shot at that one.
I can actually give an example if that's okay.
Sure.
And I'm so glad to hear from Joanne and Christina that they felt empowered to make changes. But one of the suggestions that came from the residents that we as a faculty acted upon just this year was that the OB rotation can be quite long, with long hours and somewhat isolating. And so it's typically a 4-week block rotation, and the recommendation was to create a maternal child experience, which would break the second 4-week block into two-week blocks, and then interpose the newborn rotation in between. So it would be 2 weeks of OB, 2 weeks of newborn, 2 weeks of OB, and 2 weeks of newborn. And we've had great, that suggestion came from residents, and that so far has been a great hit. It solved the isolation problem. It improved continuity between the OB staff and the newborn staff, with the resident kind of being the mediator going between. So I mean, I think you're absolutely right. Feeling that your recommendations and your thoughts are valued and having people act on them, I think that contributes to wellness.
Imogen, are you okay?
Everybody all right there? All right, how about Christina or Joanna? Do you want to take a stab at that, or shall we move on to let's have you, actually, I'm going to ask you to take a stab, one of you at least take a stab at that.
Yeah, I can just kind of piggyback off of what Dr. Holder said. I think it's just so important, like in this process, regardless of what residency you end up in, is just being sure that there's a voice for the residents to be heard. And I think that our residency does a really great job of that, and kind of eliciting feedback from us at every stage in the process, and really feeling like that's being heard, with that example of labor and delivery, but also kind of in thinking about, that the medical training process and the educational process is, everyone has a different way of how they learn and how they grow. And so just having the flexibility within the program to be able to adapt to different learners is really important. I think some of the other examples that I have aside from the labor and delivery in our program specifically are in thinking about, changing from like a Tuesday start. We start our rotations on Tuesdays, and in thinking about maybe pushing that to a Monday start, or in kind of other curricular changes. Yeah, our program's pretty awesome about that.
Joanna, do you have anything to add?
Yeah, I think we have a lot of resident feedback in terms of evaluating the program in each rotation twice a year, and getting resident feedback about that. And I think our program does a nice job making sure that we really maximize kind of high quality learning when we're in the hospital, and making sure that while we're there and learning, it's really a good learning experience. And then trying to kind of minimize times when you're in the hospital but might not be doing something productive, where you might just be feeling isolated or away from home, and that you're not learning that much. And so I think we really do a nice job making sure our rotations are very worthwhile and learning filled while we're in the hospital or in clinic.
Great. So there's always a lot of value to be thinking a few steps ahead. And so I want to add, since you're third year residents, I'm sure people who are joining this Zoom session are thinking even down the road and what their future careers might look like. So I want to ask the two of you, and Kathy, you can feel free to weigh in too. What did you look for in potential jobs after residency, especially looking through the lens of wellness and balance? And maybe you could also tell everybody what you're going to be doing next year too, so they know what you're up to.
So looking at jobs was actually pretty similar to looking for residency programs in some ways, in that I really wanted to find a warm, welcoming collegial culture where you could feel like you could discuss cases with your colleagues, and that everybody was really working on the same team on behalf of the patients. And then I also kind of wanted to keep I'm going to be doing kind of full spectrum outpatient, and I really get joy out of seeing a wide variety of cases throughout the day and in a wide variety of patients, and I'll be at a job that allows me to see kind of full spectrum outpatient family medicine.
Yeah, pretty similar to Joanna. My process was basically the same as looking for residency, in that I really wanted to find a place where I could call home and really find an extension of my family, and also be close to my family. So I am going to be heading closer to home and doing outpatient full spectrum work. And similar to Joanna, is like having that diversity in kind of your patient population and what you're able to do really kind of breaks up the day and brings joy and meaning to what I'm able to do. So it'll be definitely a smaller area, but I'm very excited to go on to the next.
Great, thank you. So I just got a message from Kathy Holder that she had to sign off. So hopefully,
no, I'm still here. I'm still here. I think that might have been. I think that might have been my husband. My husband, who's a family physician, might have zoomed in too to the discussion.
Oh, good. I'm glad you're still here.
Yeah.
I was wondering if everything was okay.
No, I'm here. I'm here.
Great. So at this point, I want to kind of open it up and ask all of our, I don't want to call you viewers because you're participants. I think that's a better way to call it. We can take this one of two ways. Either you can throw some questions at us through the chat, and then I'll call you out to ask those questions of our panelists, or we actually develop some questions that we thought we could ask all of you too, if you'd like to make this more of a round table. We have 22 participants on, so I think it's a manageable number to try to do a little bit of discussion. We didn't know how many we would have, and if we thought if it was a lot, that might be a challenge. So anybody want to weigh in on behalf of the participant group about which way you'd like us to take this? You can weigh in through chat or by just speaking.
Hi there. I'm Angie. I met Dr. O'Connell a while ago, and he's been great in introducing me into these meetings. And it was nice meeting you guys all. I think it would be nice to kind of have some time for us to ask some questions, just freestyle.
Yeah, go for it. I'm gonna put. Do you have a question that you want to kick us off with, Angie?
Yeah, I have a quick question. As Marisa, I'm also a rising M4, getting ready to apply for residency programs. And in terms of related to wellness, and I was wondering, since a big part of it has to do with your personal hobbies and things that you do to help you unwind, how big of that that component can be discussed in your, let's say, personal statement, or like how often do these kind of personal hobbies type of questions come up during interviews, even with you know, in the future down the road when you apply for a job after finishing residency, and also with med school transitioning to residency?
Mhm. Yeah, do you want me to? I can address that. I mean, I think when we're looking for people and applicants who have resiliency, so we will love to hear how you handle stress or how you handle ups and downs, and that gives us an idea with the activities that you describe. You know, how you have built resiliency in your life. And so, yeah, we're always happy to hear about how you deal with you know, with life's ups and downs.
I'm supposed to be the host and not a panelist, but I like during I interview everybody who comes through. I use that as a way to just get to make it a conversation and get to know people. And I always ask at least one question about one of your hobbies that you've put into your application. Mm-hmm. It's just a nice way to get away from all the medical stuff and get to know you as a person, because that's really what we want to do. So I don't know about putting too much of that in a personal statement. Like you could put some perhaps, but it's listed there in your ERAS application. And so utilize that as an opportunity to build out another facet of yourself. But Joanna, Christina, do you want to weigh in at all on that one?
Just having interviewed some people for our residency program, I often ask about that, actually pretty much always, just as kind of a way to have a nice conversation and get to know somebody better. Certainly not to judge anybody's extracurriculars, just to get to know you.
Right.
I agree. And even just thinking about it from you as the applicant's perspective, like I think it's important that you're able to connect with people. And so if that's your way to kind of, you know, feel out what that relationship could be, and sharing those kind of hobbies and interests, I think that's super important for you to figure out where your home is going to be.
Great, thank you all. Can you all see the poll results on your side?
Mm-hmm.
Okay, I just shared them with the group.
Great.
Does anybody else have a question that you'd like to pose to the panelists?
Hi everyone, I have a question. This is Yasmin Baines. I'm a 4th year, going into my 5th year of med school. I'm on a 5-year track. I have a question about wellness. So what are some ways that a student or resident can advocate for wellness in an environment that may not necessarily support this structure? I feel like Kaiser Vallejo has an awesome environment, but what if you are part of a system where it might be a little bit difficult to navigate this?
That's a great question. So Christina, Joanna, if you were in a different environment that was not as hospitable, how would you advocate for that? Or even if in our program where we try to promote that, if there was a situation where we're not being promoted or we misstepped, what's the right approach for somebody who's a new resident, a first-year resident perhaps?
I think ideally trying to identify someone within the faculty or a senior resident who is very approachable and kind of voicing those concerns, and maybe getting together a group that has similar concerns would be one way to go about it. And then kind of making sure you've got a very well listed and coherent list of concerns to propose to the faculty in kind of a diplomatic and respectful manner. And then in terms of if there's really a difference of opinion between the faculty and residents, you can find a lot of wellness just within your co-residents, I think, and find group activities to do with your co-residents. Like we do, or before COVID, we did a wine and cheese night, usually once a month or so, with the residents. And there's various wellness or resident interest groups, like there was a rock climbing group in the past, and then a resident who started a yoga program after didactics. That fortunately our program was great in helping us get supplies for our residency room, but that's certainly something that could just be self-initiated by residents.
And Yasmin, I will also answer, it depends part of like what the toxicity or what the issue is. I'm a big fan of professional development and leadership development. And I would encourage you that if you identify an issue, come with a solution too, so that you're really being proactive about the process and helping to steer the process and being part of the solution. Because the faculty member, program director, department chair, whatever it is, may not know what the answer is or may hear it as complaining. But if you come in with a proactive answer to the issue, it makes it much more likely that that particular issue will be addressed and solved.
Thank you, guys.
What else is on your minds?
I have a quick question for you. I was like, hi, I'm Brad. Hi to everyone this year, and also I see a few other people from Midwestern too. So hey, Marissa, hey, Nee. So I'm also a third year, almost fourth year. I'm really interested in your guys' residency program, and I was just wondering across the board in family medicine, how approachable do you think a lot of family medicine practitioners are to the question of I don't know? I saw it mentioned in the poll that you guys actually just put up. It's something I know has been important to me. I've heard about different institutions where certain preceptors are more comfortable with residents, not knowing what to do and whatnot. I was just wondering across the board, do you feel like family physicians are, I guess, tolerating that question? Yeah.
Mm-hmm. Mm-hmm.
I'm going to bite my tongue for a moment and not answer that one and let our panelists answer. I have some thoughts on that. But Joanna, Christina, Kathy?
I'd love to hear from the residents first.
Yeah.
And sorry, I just want to clarify the question, meaning that you as a third year or fourth year medical student or a first year resident was kind of asked a question and didn't know the answer?
Sure, yes. So there's some like stories and stuff I've heard of people maybe lying or trying to make stuff up when, say, asked by a preceptor a question or a clinical case or something like that, versus in an environment where you feel kind of safe to say, I don't know the answer. It's kind of an abstract question, so I'm sorry, I'm not doing the best clarification probably, but yeah, I can try to rethink my question and come back to.
No,
I think your question's clear.
Yeah, and it's a good question. And I think family medicine as a whole, we're pretty approachable in my experience. And it's certainly always better to say that you don't know for patient welfare. And if you don't know, that's okay. And you can always look it up or ask. And just use, especially people will be impressed if you don't know something and then you go and research it, and then if there's any clarifying questions that you need to ask based on what you've researched, that people are usually more than happy to help you answer those.
Yeah, I completely agree. I think just on the whole, family medicine is just much more supportive of kind of these questions of like, I don't know, and like helping each other to come to an answer or figure out a solution. And I even just think to my office in the clinic that I share with two of my co-residents, and we constantly have questions of, I don't know the answer to this. And we kind of just bounce those questions off each other, or help each other kind of research, look to the literature to figure out, what is the answer, or what is, the treatment for this patient, or what diagnosis or whatever it may be. And I think in thinking about our inpatient rotations, when we're rounding and when one of us doesn't know, necessarily what the next step is for patient care, we tend to just use that we almost always use that as just an opportunity to learn together, or, have that person go and research it and then teach back to the group later. which I think is really awesome and really fosters that culture of growth and learning together.
Great answer. Brad, I think there's actually, is it Brad or Bradford? What do you go by?
Yeah, Brad, whatever you want to call me is fine. Yeah, Brad's probably easier, but I am not offended by Brad.
Yeah, I think there's multiple layers to your questions. You know, if the question is, what is this patient's sodium, and you forgot to check it or you don't remember, like, don't bluff. Just say, I don't remember, or I don't know. That's like a patient safety issue. And I'm talking globally now, regardless of what specialty you're talking to. It's much better to say, I forgot, I don't know, I didn't have time to look it up. Let me get the answer for you, instead of just saying something, because then your attending or your senior resident is not going to know what they can trust from you, and you'll have eroded that trust. So
absolutely.
Then the next question is, like, if you're asked to come up with an assessment or a plan and you don't know, my feeling is that's fine. And in fact, when I'm precepting a resident or a medical student, I will prep the session by telling them, I'm going to ask you, as if you were on a desert island, come to me with an assessment and plan, and talk about your rationale for the assessment and what you think you might do. And in the midst of that, tell me, I don't know, but this is what I think I might do. Because really that helps me know where your knowledge gaps are. And then I can try to teach to those, and we can learn, we can talk about it. And it's just it creates a much better learning environment if I know what you know and don't know, or what you're not sure about. And on the flip side too, you know, your attendings don't know everything, despite how much they might want you to think that they do. And I think there's a real power in it when you ask an attending a question, or there's a clinical scenario, for the attending to be able to say, Brad, I don't know. Why don't we look that up together? Or Brad, I don't know. Why don't you look it up and come back to the team in an hour and give us a 5-minute spiel on that topic so we can all learn together. There's power in that, and then everybody benefits from somebody letting their guard down and showing that they don't know the answer. And again, it's also a patient safety issue. If I, as your attending, don't know and try to bluff my way through, we potentially are putting that patient in harm's way.
I completely agree, Ted. I mean, I would prefer as a preceptor for my learner to be willing to be humble and vulnerable and say, I don't know. And then I mean, family medicine in general tends to be a very collaborative profession. And like Ted is explaining, hey, let's go look that up together, or let's learn together and raise each other up.
Yeah, and hopefully in the places you've worked, you've seen attendings that have offices near one another, walking by and asking, what would you do in this scenario? There's a lot of gray areas in medicine, and a lot of different ways to manage patients, and a lot of uncertainty. And hopefully you can find an environment where people work like that, where they do bounce ideas off of one another and ask questions.
Absolutely. Thanks, Sal, for your input. Yeah, I think my question was more directed towards, like, do you feel like family practice practitioners in general are more accepting of that? I didn't mean to like give the assumption that like I was going to lie or anything. I hope.
No, we're not. No, that's just general advice, because there have been plenty of times in my life where I was, that would have been the easier way out, right, than saying, I don't know. But it's just better not to do. So no, you did not imply that, and we did not infer that.
Oh, no, I'm sure.
No, and is family medicine, I happen to think we're more collegial than a lot of specialties, but you know, there's great people in all specialties. So it just, you have to find the right environment.
Thank you.
Sure.
Don't stress, Brad, you're good.
All right. Hi, Hugh.
Oh, hey, Dr. O'Connell and Dr. Holder. Thank you for organizing this. Hey. So I have kind of a weird and maybe slightly morbid question, but over the years, in your experience as like a residency director, I mean, you've seen many residents, and people have lives and loved ones and stuff. Have you ever had a resident face something catastrophic in their personal life, like the death of a loved one? And how have you handled it? And what would you have done differently, if anything at all? Just curious.
That's a great question.
Yes, we have Kathy, I want to make sure that I'm not becoming a panelist, and I will weigh in, but let me let Kathy.
Sure, sure. Yeah, you know, residency is it's a big commitment, but it's not your entire life. I always share with the residents, you know, being a physician is what you do. It's not necessarily who you are. And we get it. We understand that life goes on, and at times that there are going to be some unforeseen occurrences, tragedies. And yes, I have had residents who have lost loved ones, a brother, a mother, and you know, you have to step back and say, okay, residency is important, but it, it if need be, it can be put on hold, because we want you to be well. We want you to be able to be healthy, to be a healer yourself. And so I've had several occurrences where I've had to, you know, I've allowed the resident time to deal with personal issues, tragedies. Absolutely. And we also, you know, not only giving the resident the time, but giving the resident the resources, behavioral health, you know, academic resources that could help keep the resident on track and things like that. So, yeah.
Yeah, that's a great question, Hugh. I think I've been in this long enough that I've seen all kinds of different issues come up, and you know, each one is unique in its own way. And I think as Kathy said, we have to realize that this is our job, and it's not all of life, and life still happens while you're a student and while you're a resident. And we need to be flexible and supportive. And we've had, you know, even in the last few years, tragedies, sudden tragedies, and our response has been go deal with that. Mm-hmm. At a drop of a hat, and we will take care of the clinical piece. We'll get your shift covered. We will do that, and let us know how can we support you. And I think that as you go and look at residency programs, hopefully you want something in that, you know, that type of, try to predict that you'll get that type of response, because you know, this is an all-encompassing job. It's serious, it's aspirational, and it's a job. And you need to realize that your family's lives and your loved ones' lives are more important than that job. And you want a place that'll support you.
Thank you.
Sure. I think Kirat has a follow-up question, perhaps.
Oh yeah, hi everyone. My name is Kira. I'm a third-year student at Touro University, and you might have kind of already answered this, but basically my question was that if you see a fellow resident starting to burn out or starting to experience high levels of stress and sort of falling off of the rails of wellness, how do you go about showing support for that co-resident?
I'm going to ask Christina and Joanna to address that one, as that sounds like a great resident question.
Yeah, that is a great question. I think the biggest way is to just let that person know that you're there for them, and to really kind of foster and give that space of allowing them to trust in you, that they can share that with you, and to kind of be an ally for them, and to advocate for them when they can't. I think that's probably the biggest first step, is to just be a friend among, you know, above everything else.
Joanna, do you have anything? That's a great answer. Joanna, do you have anything to add to that?
I totally agree with Christina. Yeah, if you're seeing somebody struggling, just wanting to be kind of mindful of their personal space, but also just giving a space to check in, or just in some ways we're often proactive in checking in, like if we know that somebody's going on a really tough rotation or is on nights, just sending nice like texts and checking in texts. And our chiefs this past year have been checking in with our interns who are on more difficult rotations via phone call as well. So just trying to be both supportive if you see it happening, but also especially as a senior resident, recognizing what rotations might be tough for your your interns or second years and reaching out to them if they have anything that they'd want to talk about or any questions about a rotation.
Great, thanks, Joanna. So I want to be mindful of time. I think we maybe have time for one, perhaps two more questions. I would love it, though. I want to give everybody my personal email address so that if you have any feedback for us on this session and how we could do it better next time, or ideas for future sessions, or any other thoughts on this, we would love to hear that from you. So you can email tedoconnell@gmail.com, 2 N's, 2 L's, no apostrophe. And before we get to the last question, or maybe the last question, I saw one from Shane, but before we do that, I'm going to ask Francisco Dorado, who's one of our faculty, is on here. I just want him to say something. So you could see, he looks like he's chilling like a villain there. I want everybody to see what the life of a family medicine attending's like.
Here we go.
Hi, Francisco.
Hi, Dr. Dorado.
Hi.
Hey.
I'm sorry, I logged in late. I drive in from the clinic.
No,
Yeah, I'm in my backyard.
Yeah, I was just seeing the video, the picture there of you leaning back in your chair with all the trees and the sunshine behind you. I was jealous.
Nice.
Yeah. Well, I'll chime in later if I have time. If you need me.
No, not at all. If you want to. Shane Jones has a question for. It sounds like really for the residents.
Hey everyone, my name's Shane. I'm a rising 4th year at Michigan State University, and I just really had a question, like, as soon to be applying to residencies, how do we as medical students, with COVID and all that, how do we best kind of gauge or kind of figure out a program's commitment to wellness, or when we don't really have that face-to-face interaction?
That's a great question. And I think I'm married to a Spartan, so I'm supposed to say go green. So.
That's right. That's why you're asking this question.
Go white.
I went to you, bitch, so I'm not gonna.
That's a really good question, and something that's going to be probably harder to gauge if they're doing. I think they're still kind of working on what the interview season is going to look like, but it might be virtual. And so I think it will be harder to see, because if you're not walking, there might be virtual tours, but you won't be walking through the clinic and seeing how people interact as much. So I think certainly asking the residents that you interact with during any interview process kind of what brings wellness to them and how they handle any stress of residency. And then, and certainly kind of you can look through any residency websites to see if there's any wellness activities as well.
Christina?
Yeah. I think also just kind of reflecting on what's important in terms of your own wellness and trying to kind of elucidate from those programs if they have similar kind of feeling towards, what wellness is and how to foster that specific to how it would kind of help you to thrive. And I think, like Joanna said, really kind of taking the opportunity to talk with the residents and kind of get a sense from them of what that culture is like is going to be really important if it's largely virtual.
Great, thanks, Christina. So it's 6:30 on the dot. I do want to be cognizant of everybody's evenings. Marisa had one follow-up question, so we'll take that one and then we will wrap. And I promise you we will have more of these sessions. We're going to try to do them at roughly 2-week intervals going forward, so that we really want to understand that the process of applying to residency programs is stressful anyway, and this year's particularly just a new environment. And so we want to do whatever we can to help support you in that, whether you're going into family medicine or not. Medicine is a small community, and family medicine becomes even smaller community. And at the end of the day, we want all great physicians out there caring for our communities. So whatever we can do to try to help smooth the process and reduce these anxieties, we will keep doing these sessions to help support all of you. So Marisa, you want to take us away with your with the question?
Sure, and maybe this is a question that could just as easily be answered over an email, but I noticed that both in the poll and I believe Joanna mentioned balance, and it was just something just in terms of, you know, supporting all of your residents like you have mentioned so thoroughly. I was just curious more, like want some more information about that. I've just never really heard of it before.
Yeah, it's lovely. And we especially used it our first year. I think it's twice a week sessions with our behavioral medicine faculty, which includes a psychologist and a psychiatrist. And then we come together as a group over lunch just to discuss any concerns that have come up, whether it be a difficult patient encounter or often for us it's like a sad patient encounter, or really any concerns at all. And our psychologists and psychiatrists kind of facilitate it, but it's often more of a group discussion amongst the residents and just really sharing amongst ourselves, and it's all confidential. And so it's just a safe space to air any concerns or really any kind of emotional difficulties that come with being a resident.
Yeah, and Marisa, you can look it up too. There's actually a very kind of a formalized process around the idea of a Ballant group. A lot of them in residency programs end up becoming more of like a support session and chance for people to just talk through difficult cases. But there actually is kind of a formalized process around Ballant, and which is why it has its own name. But you'll see a lot of different takes on what that actually becomes. But it's a chance for people to get together and take some of the load off of their chest and think through things. There's another one called Schwartz rounds that I think is more intended for inpatient processes. So yeah.
Thank you so much for answering. I'll definitely look into that a little bit more.
Absolutely. So I want to thank all of our participants for joining us this evening. I hope this has been valuable to you. Please do give us your feedback. I especially want to thank our three panelists, Christina Rodriguez, Joanna Ingebrigtsen, and Kathy Holder, for taking the time out of your evenings to share your thoughts and insights. We'll all give you a virtual appreciation. Thank you very much.
My pleasure.
All right, everybody, have a great evening. And if you're enjoy the weather, if you're in California, it's a nice evening out. And otherwise, be safe and healthy, okay?
Thank you.
Here, everybody.
Thank you so
Thanks,
much.
everyone.
Our pleasure.
Bye, everybody.
Our pleasure. Bye-bye.